Adam Alliance ignites powerful, sustainable change throughout Alabama, Indiana, Kentucky, Mississippi, and Tennessee. We make healthcare better by improving care transitions from one provider to another, improving communication between providers, and improving how they work together. That's why Adam Alliance supports 36 medication safety work groups, engaging 450 prescribers to prevent adverse drug events. We also created the Team for Innovation in Medication Safety.
As a member of the TIMES group, I work with other healthcare providers and pharmacists from 5 states to create new medication safety tools.
Our first tool helped doctors take their patients off of acid-reducing medicines known to have negative side effects. We reached more than 90,000 patients, preventing potential adverse drug events like fractures or pneumonia.
Adam Alliance has achieved a 6% reduction in adverse drug events. This reduction represents 2,852 fewer hospitalizations and a cost savings of $48 million. We bring providers, advocates, and stakeholders together to collaborate and improve transitions of care for older adults. We support 35 care coordination communities across our 5 states. Our work with these communities has impacted 2 million people with Medicare. We estimate that we have prevented more than 1,300 avoidable hospital readmissions, for a cost savings of $12 million. In Tennessee, we saw a need for the leaders of the state's care coordination communities to regularly meet and share ideas. Now known as the Community Action Network, this group has grown to include all 5 of our states.
This network is a great opportunity to share best practices and bring that information back to our coalition. For example, we implemented evaluation forms at our coalition meetings after learning this strategy works for another community.
In Alabama, we helped a care coordination community recruit parish nurses from local churches to contact congregation members after they leave the hospital. The nurse ensures they have the correct medications and understand how to take them. The participating community lowered their hospital readmission rate from 19% to 16% in 2017.
There were 119 people cared for by a parish nurse during this project. Only 19 of those were readmitted to the hospital within a month after being discharged. After this success, we're spreading this approach to 5 additional churches this year.
Our Patient and Family Advisory Council brings together people with Medicare, family members, and caregivers to give us direct feedback on what matters most to our patients. One outstanding advisor, Bill Gossard from Indiana, has worked with our group to develop a resource so patients can better manage their medications or those of a loved one.
I think the patient needs to become as knowledgeable as possible about their medications. Know what, why, how, and when to take your medications. Ask questions.
In Indiana, our advisors provided their feedback on 2 public service advertising campaigns in the state. They crafted the message to best reach the Medicare population and moved them to take action.
Having the patients and family members like Mr. Gossard engaged in our work has given us insight into their perspectives. It has increased the effectiveness of our tools and messages.
Adam Alliance promotes immunizations for older adults to prevent influenza, pneumonia, and shingles. These vaccinations reduce illness outbreaks, hospital stays, and even deaths, particularly in older adults. In Kentucky, our team partnered with a statewide network of community action agencies and participated in more than 60 activities. We've reached almost 1,100 seniors through outreach events like diabetes education classes, health fairs, and immunization clinics in less than a year.
Flu and pneumonia cause 600 people nationwide to go to the hospital each year. Our care coordination communities play a big part in helping to prevent some of these hospital stays with vaccinations.
Across the Adam Alliance, 1,022,582 people with Medicare have received 1 or more of the recommended vaccinations in the last year. In Mississippi, the care coordination community worked with our team members to implement pharmacy-directed transitional care with their local hospital.
By implementing this proven best practice, we lowered our rate of readmissions from 26% to 10%, and we've sustained that success for several years.
By bringing the right people together and giving them the right tools, the Adam Alliance is using innovation to improve care coordination within our region and beyond. Through keeping the patient at the center of our work and reducing provider burden, the Adam Alliance is making healthcare better for people with Medicare.